Here is Israel.
My name is Nadir Arber. I'm a gastroenterologist from Tel Aviv Medical Center and Tel Aviv University. What you are seeing here is something unique that I have established. I've learned it from my colleagues in the US, especially from Professor Bernard Levine, who used to do this task at the MD Anderson. But what we have here, the Integrated Cancer Prevention Center, is in fact the only center that prevents cancer around the world. What we are doing here is bridging between science, basic science, and the patients. In the last 4 decades, the mortality from cancer only slightly decreased, not as one would have expected. And the best way to treat cancer is to prevent it. From what I'm a gastroenterologist, and what I'm doing good, and I have a good reputation around the world, is prevention of colon cancer. We do colonoscopy, we find the polyp, we take it out, we prevent colon cancer. So what we have established here is a unique institute, a unique department, a unique center, one-stop shop. People, healthy people, no symptoms, no family history, are coming to this place, and within 3 to 4 hours, they are undergoing screening tests for the 11 cancer that are accounting for the mortality from 80% from cancer. So breast, ovary, gynecology, lung, colon, and people are undergoing this test at the same time, the same spot.
Hi, my name is Dr. Dana Madorski-Feldman. I'm a general surgeon here. My main role is to examine women for breast cancer. Apart from giving the exam, the physical exam, we also consult women who have doubts about genetic consultation. Usually those are women who have a very extensive family history of breast cancer, ovarian cancer, and sometimes colon cancer or stomach cancer. And they sometimes are not sure if they want to do the examination or not. So they have to have an explanation, what does it mean in terms of genetic, familial, and psychological meaning. If they do go through the examination and found positive, they are offered a professional genetic consult for further explanation of the results.
So far, 7,000 people attended the centers, and surprisingly, we did find something in about 10% of them. In most of the cases, it was premalignant lesions. Maybe because I'm a gastroenterologist, we find a lot of polyps, but we also find some tumors, all of them in early stage. All of them were successfully treated, and now they are healthy. Another thing that we are doing here is translational research. We also have a molecular biology lab, and currently everyone is coming because we do not know how to differentiate between something who is real healthy or someone that is healthy, but the disease is starting to bud somewhere in his body. So we are developing new tests that will enable us to differentiate between healthy subjects and people who has a disease. We are developing blood tests for looking for colon cancer. We are developing a score that will help us to identify those high risk for developing a variety of cancers. Right now, and if you wish you can be a part of it, we have an amazing way to detect lung cancer based on the air that you are breathing, and you give it to mice. And surprisingly, mice have 1,000 more receptors for smell than dogs, and everyone knows about dogs that can find drugs, they can find explosive products, they can even smell money. And this is a study that we are currently doing. We're also developing all kinds of monoclonal antibodies or adenovirus in order to treat cancer, trying to think outside of the box. If we try to think inside the box, we have no chance of competing places like the US, Europe. So in Israel, because the resources are limited, we must try to think outside of the box, and this is what we are doing. If any one of you wish to come to Israel, we are very happy to to welcome you here. We are very open to collaborations. We have collaborations across the world, US, Europe, China, Japan, you name it. And we are very happy to continue these collaborations. So thank you very much, and I highly appreciate your coming here, and I'm at your service anytime.
Here is Israel.